So good morning, everybody. It's good to be here. Thank you for joining all of us. Today, we're joined by Steve Tang he's the CEO and president of OraSure Technologies, and we're here to announce that he's going to be expanding, and OraSure is going to be expanding their manufacturing operations in Northampton County. As part of this expansion, OraSure plans to develop a rapid antigen self-test to detect active COVID-19 infection on the spot, as well as a highly accurate antibody test that would detect a prior COVID-19 infection. So the antigen test and the antibody test. This is good news. Obviously, anytime a company says they're going to expand or locate in Pennsylvania, but this is especially good because in addition to bringing 177 new jobs to the Lehigh Valley, to Pennsylvania, this is going to do a lot to help us in the Commonwealth fill a testing need that we have. We have built a lot of capacity, enormous capacity as a Commonwealth in terms of testing. And surges in cases occurring in the South and Southwest have shown that Pennsylvania's done a fairly good job, but that's been a problem for us because the National Testing Services actually put Pennsylvania farther down the list as a result of our fairly good record. We're not a hot spot. The hot spots are getting priority, which I understand, but that means that we're paying the price here in Pennsylvania in our efforts to mitigate the virus because our tests are taking longer and longer to get back. We had a conference call yesterday with one of the National Testing Services actually doing a good job. But in many cases, the wait can be up to 2 weeks for test results. So this is really important, again, not just because OraSure is adding 177 jobs in Pennsylvania, but it's important because this is going to add to our ability to do fast turnaround time testing for Pennsylvanians. And this could help us in the future as we look to the new normal moving forward in terms of making sure that our testing capacity is not only we're at the place we want to be in terms of total numbers of tests, but the turnaround time is good, the way it's administered is good, and that we're able to do the contact tracing that we need to do. This is going to be a big help. I think Dr. Tang is going to talk and Secretary Davin about what the company is going to be doing, but they hope to be moving fairly quickly on this. And Pennsylvania has been supportive through our GATT process, the Governor's Action Team, to help make sure that OraSure expands here in Pennsylvania. So now I'd like to turn it over to Secretary Dennis Davin to talk a little more about this. Secretary Davin.
Thank you, Governor. I really appreciate the opportunity to be here today. And as the Governor talked about, we are very thrilled to announce this business expansion in the Commonwealth that will bring new full-time jobs to Pennsylvania while supporting our efforts to mitigate the spread of the novel coronavirus and protect the health of our communities. So OraSure Technologies is a leader in the medical device field, and their expansion in Northampton County and Bethlehem will retain more than 200 jobs, and as the Governor mentioned, create 177 new jobs. This will bring new opportunities to the Lehigh Valley as we navigate one of the most unprecedented times of our lives. In addition to boosting the Lehigh Valley economy, it will benefit our Commonwealth as a whole, with OraSure developing a rapid antigen self-test that can detect active COVID-19 infections. In basic terms, that means no waiting times for lab results. At a time where we're working to ensure that testing is available to individuals across the state, developments like this are critical in helping Pennsylvanians know their status and protect family, friends, and communities. Testing capabilities are a major factor in mitigation efforts and in how we can identify COVID-19 infections and halt their spread. And this expansion couldn't be timelier as many Pennsylvanians are ready to get back to work safely. Our Commonwealth has historically been home to innovation, and as we in the Wolf administration often note, a can-do spirit. So it's only fitting that OraSure has decided to call our Commonwealth home. With the creation of these jobs and the advent of new rapid testing capabilities, we're building on the legacy of innovation while providing a product that Pennsylvanians need. While no one could have predicted or prepared for the COVID-19 pandemic, the Department of Community and Economic Development remains steadfast in our efforts to support businesses and communities across the Commonwealth. Over the past several months, Pennsylvania's businesses have stepped up to provide critical services, switching their production lines to create PPE, altering their business models to ensure minimal supply chain disruption, and finding creative ways to continue to serve their communities. And because of their efforts and the Wolf administration's commitment to supporting them, our state remains strong. We will recover from this, and today marks a great step in the right direction. So on behalf of the Wolf administration, I want to congratulate OraSure Technologies on their expansion and for their commitment to supporting our state as we reopen our economy. So now I'd like to turn the podium over to OraSure President and CEO, Dr. Stephen Tang.
Thank you, Secretary Davin. I'm honored to be here this morning and represent the great employees of OraSure Technologies who are working tirelessly to bring our COVID-19 test into the market. Governor Wolf, we appreciate all that you and Secretaries Levine and Davin have done to keep the citizens of the Commonwealth as healthy and as safe as possible during this pandemic. As you've advocated strongly through policy, saving lives and livelihoods are mutually inclusive and necessary. OraSure is proud of our Lehigh Valley headquarters roots and our successful founding as a company nurtured through Ben Franklin Technology Partners of Northeastern Pennsylvania more than 30 years ago. We are extremely grateful for this funding awarded through the Department of Community and Economic Development and the Governor's Action Team to assist us in commercial scale-up of our COVID-19 rapid antigen test. For those of you not familiar with OraSure, our family of companies is pioneering new paths to improve health and wellness on a global scale. Our innovative sampling tools, services, and diagnostics unlock access to accurate, essential information that advances global health and well-being. We're a global leader in infectious disease diagnostics with a legacy of helping to solve the world's most difficult diagnostic challenges. We have the first and only rapid HIV in-home test approved by the FDA, and the first and only World Health Organization pre-qualified rapid oral HIV test. Our OraQuick Rapid Ebola antigen test is the first rapid diagnostic test the FDA cleared for marketing in the U.S. for the Ebola virus disease. All are built on our unique OraQuick lateral flow platform that provides accurate and easy-to-administer testing methods. Our technologies are the ideal platform for the emerging trends in diagnostic testing, and they are certainly ideally suited for the current COVID-19 testing dynamic. I'm proud that OraSure is bringing its expertise to the battle against COVID-19. Scientists in our Bethlehem labs are developing 2 COVID-19 tests that we believe could be key contributors to the testing paradigm: the OraQuick Coronavirus Rapid Antigen Self-Test and the OraSure SARS-CoV-2 Oral Fluid Antibody Test. In addition, our saliva collection devices are already being used for the collection, both in-home and in professional settings, to transport samples for COVID-19 molecular testing. We've been able to respond quickly to the COVID-19 pandemic because we have proven experience developing accurate tests for infectious diseases, working with regulators like the FDA to get them approved, and scaling to global markets. The OraQuick Coronavirus Rapid Antigen Self-Test would quickly detect active COVID-19 infection at the point of sample collection with no instrumentation needed to interpret the results and no need to transport samples to labs for analysis. Essentially, it's a lab on a swab. Pending regulatory approvals and launch, individuals would be able to obtain the test, take it on their own, and read their own results in a short time. This could be invaluable in opening up new economies and keeping them open, and enabling the safe return to work, school, and group events. Our test has the potential to be a game changer to better detect and eliminate coronavirus. As we said, our goal is to test anybody, anywhere, and anytime. And so if I may, I have to give a shout out to the Philadelphia Flyers, whose slogan these days is anytime, anywhere, the #1 seed in the Eastern Conference. To date, there are no diagnostic tests for active COVID-19 infections, which can be conducted without the need for instruments to interpret results. Our OraQuick Coronavirus Rapid Antigen Test, therefore, has the potential to be the very first COVID-19 test for active infection, which can be conducted easily without instrumentation or laboratory. Now, we're all hearing the rising chorus calling for faster and more frequent testing, both here in the Commonwealth and across the world. A recent Rockefeller Foundation report on testing specifically calls out the need for rapid, convenient tests like the antigen test OraSure is developing to help get the necessary 30 million tests per week by November to achieve lower suppression levels. Both our antigen and antibody tests are currently in clinical trials, and we plan to file for emergency use authorization from the FDA to launch both products in the fourth quarter. So through the leadership of Secretary Davin, the Governor's Action Team, Executive Director Brent Vernon, and their teams, including Neil Weaver, Sherry Collins, and Janet Smith, we are pleased to accept Pennsylvania First grant and the job creation tax credits. The grant and incentives will help OraSure invest in our COVID-19 product growth and help us create more high-quality jobs in the Lehigh Valley. We're grateful to the DCED, the Governor's Action Team, staff for working closely with us in authorizing this package. In closing, we're immensely proud of our dedicated Pennsylvania team members and the extraordinary work they do. We thank Governor Wolf and his team for the ability to retain and grow our Bethlehem workforce as together we work to end COVID-19. And now I have the honor to turn the podium over to Pennsylvania's most devoted, tireless, and resilient Secretary of Health, Dr. Rachel Levine.
Well, good morning. Thank you so much, Dr. Tang. Thank you, Governor, of course. One of the keys to stopping the spread of COVID-19 is access to testing. We have worked to expand testing throughout Pennsylvania, and we are now testing approximately 4% of the population each month. But we need to do more, and OraSure's innovation will help us with the resources to do just that. An accurate, rapid test that could be administered by the person themselves or by a medical provider means that we will know if someone is positive for COVID-19 very rapidly. We can then take action almost immediately to get them the health care that they need, but also for us at the Pennsylvania Department of Health to begin our case investigations and contact tracing to contain the spread of the virus. As I have said before, heading into the fall, one of the key tools that we need in this effort is a rapid, accurate point-of-care test. Congratulations to Dr. Tang and OraSure Technologies for answering the call. Pennsylvanians can answer the call in a different but also meaningful way to stop the spread of COVID-19. You are stopping the spread when you wear a mask. You are stopping the spread when you avoid large public gatherings. You are stopping the spread when you use hand sanitizer and wash your hands frequently. Pennsylvanians want to stay at work. Pennsylvania children want to go back to school. Our actions as a community directly impact our ability to do those things. So please, adapt your activities to protect against the spread of COVID-19 and wear a mask. And what I always like to emphasize is please stay calm, stay alert, and stay safe. Thank you. And now I'll turn things back to Governor Wolf.
I'd be happy to open it up to questions. Yes.
There have been some antigen tests rolled out in the past, and I think some other point-of-care type tests that have turned out not to be very reliable. What makes us think that this one will work, and what is the likelihood that it will work, and what's the earliest reasonable time frame that it could be working in Pennsylvania?
But I noticed you weren't looking at me when you asked this. Let me start with Dr. Levine, and then maybe Dr. Tang wants to. So, Dr. Levine.
So thank you. We have spoken, in fact, I believe last week, about the different types of tests, the PCR or the tests for the DNA, the antigen tests, and the antibody tests, and they're all different. There are, I believe, 2 antigen tests that are available now. They all have to be done with a machine. They can't be just done on the counter, and they can't be done by the person themselves. You have to have the equipment to do that. And they have some issues, particularly in terms of the sensitivity or the false negative rate. So it's not that they're not useful, but they have to be used in some specific ways, and you have to know that information about its sensitivity and specificity to be able to interpret the results. I believe OraSure Technologies has some new and innovative ways of adapting to that, and I'll let Dr. Tang comment.
Dr. Levine is right. There are only 2 rapid antigen tests on the marketplace today. They both rely on equipment and the use of laboratory personnel to administer the tests. So an individual cannot take the test and get the result themselves. What OraSure relies on is our history of producing highly accurate tests. As I mentioned, our HIV in-home test is the only FDA-approved test for an infectious disease that you can buy in a drugstore or online. Right? We're the only ones. The sensitivity and specificity for the test is in the high 90s. And then I mentioned our Ebola product. We have the only FDA-approved rapid test for Ebola that is licensed to sell in the United States. The negative correlation value for that test is 97.5%, and the positive correlation is 100%. So that means that for that particular test, if you're negative, you have a 97.5% confidence, and if you're positive, you have 100% confidence. So unlike most companies who are just getting started in this area of rapid tests, we have products that have been performing for years, and so we're very highly confident. I mentioned the product launch in the 4th quarter of this year. We hope to make it available by building product at risk, that is, with our own money, investing in the manufacture of products to be on the market by as early as the 4th quarter. So we're hoping this gets to the market quickly, and we hope that the people of the Commonwealth can benefit from it.
Yeah, so you're saying you believe that when you say the 4th quarter, yeah, you mean sometime before the end of the year, this product could actually be in use in Pennsylvania? And
Yes.
say like in sufficient quantities?
Well,
Because I must, go ahead.
Yeah, so sufficient quantities is a tricky thing. I mean, there's an insatiable need for testing today. There will be a supply. It will not be the 30 million tests per week that we talked about, but there will be a supply initially.
Like, for example, in Pennsylvania, if you talk to, say, nursing home administrators, they talk about how profound it would be if
Yes.
they had a really fast test. In fact, some of them think that that's the only way that we're really going to be able to have visitors coming back into nursing homes. I mean, would you think that this test could solve that problem and within this year?
I certainly hope so. I have an elderly uncle who has special needs in a nursing home that contracted COVID-19, and we were very concerned about him. And of course, none of us can go visit him then or now, and so I certainly appreciate the issue. And the answer is yes. Our test could profoundly help settings like nursing homes, but also they could help school systems, employers, prisons, anywhere where there's very hard to access and get people into testing quickly. So we recognize the potential impact of the product, and we're doing everything we can to make sure that it is affordable, reliable, and performing the way that'll help everybody.
Hey, 2 more things I'd like to quick ask. How much is your company getting from Pennsylvania, and what guarantees are there, if any, that, I mean, it sounds like there would be your test would have tremendous value, possibly worldwide demand. And we've seen situations where governors, for example, have had to pay exorbitant prices for various things. What I'm asking is, what guarantees are there, if any, that your product wouldn't wind up being like meeting huge demands elsewhere as opposed to in Pennsylvania?
Well, we're working very hard. OraSure has been a community-oriented organization for some time in the Lehigh Valley and across the Commonwealth. And so we're working very hard to make sure that the local community is addressed. I mean, as an employer, for example, we want our employees to get back to normal, come back to work. And so we have to make our product available for them as well. And I think we've proven through our business model and the way we sell products, not only in the U.S., but to global public health, that we have created an effective, affordable product.
Dr. Tang, I'd like to comment as well. Thank you, sir. So you're correct in terms of the potential impact of this type of oral test on long-term care living facilities, potentially schools, prisons, and other types of testing localities. So this would be a game changer. This is really that's why we're so excited to be collaborating with Dr. Tang and with OraSure Technologies. There's still an approval process in terms of the FDA, but we absolutely think that this is a critical and important tool, and we're looking forward to our close collaboration.
Yeah,
I think we probably need to go on to other questions. I'm sure you can speak with April afterwards, but other people I'm sure need questions. Go.
Dr. Levine,
Sure.
could you just speak specifically to, from a public health perspective, how being able to test so rapidly would be key to getting back to, quote, normal?
Absolutely. So right now we're doing the PCR tests, and there's a lag time to get results. So if the test is a priority test done at our laboratory, we can get the test back in 24 to 48 hours. If the tests are done through most of the hospitals, they can get them back through 24 to 48 hours, and that is key for us to be able to do our case investigations and then our contact tracing and our containment efforts. We did speak with the President and CEO of LabCorp yesterday with the governor. They're doing much better. They're doing really well, and they're getting their tests back within about 2 days, and that's a real progress. There are other laboratories that have 5, 7 day or more lag times, and that's because of the amount of tests being done throughout the country. There are also concerns about the chemicals and the reagents used for some of the platforms, particularly that are used by the hospitals. All of that puts our testing at risk. It delays our getting the results. It makes the containment efforts less effective. If we could have and with OraSure Technologies, a rapid, accurate test that could be done and available in 15 or 20 minutes, and we can depend on it in so many settings, that could be such an advance for us to be able to do our containment efforts to be able to stop the spread of the virus. Yes.
Yeah. I actually have a question for you in the back.
Dr. Tang.
When you say the word affordable, what is your definition of affordable? And do you see this as being something that's sold over the counter eventually, that people can do at home? And is it going to be something that perhaps you would need insurance to be able to cover some of this thing?
Right. So our HIV test is sold in drugstores today. It's sold for around $40 or $50 retail. Okay, that's not what we sell it to retail pharmacies at. That's what they charge the consumers. And so we're well aware of the consumer market. And yes, the answer is it will be eventually available for you to buy in a drugstore or online. Affordable also means affordable for public health also, both within the U.S. where reimbursement will come into play, and abroad where there's no reimbursement, but there has to be public subsidies to sell the product. We have experience across the board in all of those avenues. What is changing rapidly are the CPT codes or the reimbursement codes for the test, and as we speak right now, I think we're making great progress in terms of what reimbursement could look like to help subsidize the cost of our test. So all this is happening rapidly, no pun intended, in the development and the regulatory process and through reimbursement as well. So I think it will come to the market in a very attractive ways.
Can I ask one more follow-up question? What is the extent of how many tests you think you could produce daily right now?
Well, that's a difficult question because we have to start manufacturing before I can answer that. But I can tell you that we sell tens of millions of tests per year to the global market for HIV. And so part of the award from the Commonwealth is to help us dramatically expand our capacity. We can currently make about 35 million units of all of our tests today. The funding from the Commonwealth will allow us to move to 55 million by the end of the first quarter next year and 70 million by the end of the second quarter next year. So we are working as quickly as possible to get capacity up as large as possible.
Governor Wolf, I have a question for you.
Yeah, let me just.
Sure. Go ahead.
The importance of the new normal of testing. contact tracing and testing are going to be the key. And the kind of tests that we're going to need are obviously accurate tests, but tests that have a fast turnaround time. So when we talk about whatever that mystical endpoint is, it's going to involve testing, and we really have to get this right. So this is really important for us. I'm sorry.
That's all right. I'll piggyback what you just said there. If we hit this mark in Q4 and we can test more, does this ease restrictions in a number of different things, whether it be schools or restaurants, bars, things of that nature?
That would be the hope. I'm looking at the one example, I think, right now in the world of a really good case is probably New Zealand. And part of what has allowed them to do what they've done is that they basically isolated their country. They really are an island. But they've also done things with masks and social distancing and things like that, and that has allowed them to get to the point where they're now, the pictures of people in New Zealand are they're walking around without masks, they're walking around close together, and they can do that. But they also have a very robust contact tracing. Until we get the where we need to be with tests, they can do more tests now than before, as we can. But we still are looking for that holy grail of fast turnaround time and easy application. So I think that is those two things, contact tracing and testing, they are going to be key to getting to new normal. The faster we get both of those things up and running, the faster we get to that new normal. That's
Have you talked at all about easing or lifting restrictions on restaurants or bars since the time has passed, since that announcement came out?
No.
One question I'm getting after the guidance was released on schools was there seems to be kind of a marriage of data that would allow schools to kind of make a decision based on the incident rate, low, moderate, or high. Bars and restaurant owners are saying, why can't we get the same leeway if we're in Potter County or Cumberland County or Philadelphia County? You know what I'm saying?
Yeah, I mean, I've had conversations with on this, and I have an open mind. There's a difference between, I think, elective things that we do and central things that I think a society needs to do. We need to get our kids back to school. We need to make sure they get an education. So that's our first priority. What do we need to do in all these other things that maybe are not quite as important as that, in my mind, as getting an education for our children? And let's focus on the first things first. Education is first. Again, all these other things will allow us to get back to life as normal in whatever sequence and as quickly as we can. And that includes restaurants and bars and everything else that we do, sports. But let's start with the first point, which is what do we need to do to get to the point where we can actually have our students get an education?
And I guess that's why you've had the social media messaging about unemployment. That's why the importance would be there for folks that say, you know, this restaurant is my life, that's where I work, correct?
Yeah, well, again, we need to get to a point where we can go back to school and start to do all the other things. So one of the things we need to do is look at places where people get together. That's why I made the recommendation I did on sports. It's why we've done as a state, because we have the ability to do this, done what I did with bars and restaurants. That's where people come together. That's what the virus likes. It's not what I like. It's not what you like. It's what the virus likes. And we've got to be sensitive to that. And to the extent we can shut the virus down, then we can get back to doing the other things that we want to do and eventually get back to doing this too. But we've got to shut the virus down. That is job one. And then as we start to reopen, we reopen the things that are most important to society as a whole, and I would argue those are our schools.
Yeah, and I know I've asked 75 questions, but have you talked to PIAA at all? They said they wanted to open a line of communication with you?
Yeah, actually, I said, it was on KDK radio this morning, I said I do. I don't personally, but yes, the administration, Department of Education, we're talking all the time. And what we've done is create with our, I think it was yesterday, sent out the guidance for schools to reopen. We looked at county by county basis, looking at two specific pieces of data, the number of cases per 100,000, if it's less than 5, or less than 10, I guess, and if the positivity rate is less than 5%, that's in a low category. I think there are 20-some counties. I don't, you can get the counties that are in that category. There are a number that in the moderate, which is 10 to 100 per 100,000, and between 5 and 10 on the positivity rate. And then the substantive, the problem, the hotspots counties are above that. There's one county above that. In those, then we have different, but it's guidance. It's saying there are 500 school districts. You are in charge of your own, this is the way the law is written. And so we'll do our job in terms of giving you guidance, the data, so that we can help you in making the right decision. We all want the same thing, which is to keep our children, our parents, our teachers, our administrators safe.
Thank you.
Yeah. Anything else? All right. Thank you very much, everybody.
Thank you.